Drug maker Merck has asked the FDA to grant emergency authorization for its promising pill for COVID. Now, if cleared, it would be the first pill shown to treat the virus by reducing symptoms and speeding up recovery. Joining us right now is Dr. Suman Radhakrishna, Director of the Infectious Disease with Dignity Health California Hospital. Doctor, thank you so much.
Thank you for having me.
We want to start off by saying this is not a replacement for the vaccine, correct?
That's correct. So vaccine is before somebody even gets exposed to the virus. And of course, before they get infected. After they're infected, if they have mild symptoms, we have so far been asking them to stay at home and ride it out. If someone is immunocompromised, then they have a chance of getting antibodies. But the pill form is the newest, and it is indicated for people with mild to moderate disease.
So could this pill be a game changer in terms of the pandemic here?
The study was done and the pill was administered to people who were over 60, who had diabetes, who were obese, and they found that there was a 50% reduction in hospitalizations, which meant that the mild disease did not progress to severe disease requiring hospitalization, and none of the people in the group that got the drug died. So that's the reason why we are expediting the process so that we can hopefully save lives of people who are infected.
So what do you think? Will you need a prescription for this? Is this something that could eventually become available over the counter?
I hope not. I hope that it right now, after it's FDA approved, you'll need a prescription. There will be a list of guidelines of who gets the medication and what their symptoms should be. And hopefully after COVID is gone, we will not be talking about it.
So we talk about this as being something that treats the symptoms. Can it be used preventatively?
There is a study that is being looked at for preventative use, and there's no data on that available yet.
Okay, then the question becomes, is there a fear if this gets out there and you know you get COVID, you take this, it will reduce the symptoms? Is there a fear that it will stop people from getting vaccinated or getting their booster shots?
You know, nothing is foolproof. And yes, it will reduce the symptoms. It will prevent a large proportion of people from going into the hospital. But the best prevention is a vaccination and social distancing and masking, because that way you just don't get COVID and you don't have to worry about anything more.
Doctor, what are we talking about in terms of a timeline here? I know they stopped the trials because it looks so promising. Can you sort of walk us through what happens at this point?
So now that they have applied to the FDA has a group of doctors, scientists, chemists, pharmacists who will thresh out the details of the study and figure out what we call as drug labeling, who would benefit the most from it, what the dose should be, and for how long should we give it, what should the physicians, the treating physicians, be looking for in terms of side effects, and to the patient as to what they need to be careful about and in terms of getting monitored. And once that is all done, hopefully because they have asked for emergency use authorization, it will move quickly, and in a matter of several weeks, we should have the drug available for use. And then the question comes, do we have enough supplies? What is the COVID incidence rate? Because if a lot of people are demanding use for this drug, then we may not have enough. And hopefully we don't have to get there, because the vaccines, if people are adequately vaccinated, will reduce a big number of people who might need this drug going forward.
All right. You are so correct about that, Doctor. Thank you so much for your time and your insight tonight. We appreciate it.
Thank you.